Good day, everyone. My name is Fernando Tizaldar, and I am your student nurse for today. So, for today's video or return demonstration, I will be doing the abdomen assessment. Um, so, I will do a lot of assessment in this video. So, first is you need to wash your hands, and after washing your hand, proceed for to the next procedure. So good day, sir. My name is Fernand Daniel T. Saladar, and I am your student nurse for today. So, as we start the assessment, sir, for the abdomen, kindly can you give your hand, sir? Okay. Kindly state your name, sir, please. Michelle Elisa Manuel. Okay. How old are you, sir? Eight. 8 years old. Okay. Thank you, sir. So, after asking the patient for the information, you need to place or um, the patient needs to have a comfortable position. So, now, as you can see, I am positioning the patient in a supine position with arms folded. So, the next thing to do is um, the next thing to do is begin with the um, inspection. So, sir, don't move, sir. I will just check on your skin temperature. So, you need to check the skin of the patient to assess if there's any stretch marks or scars or lesions and rashes for documentation and for its history. So now let's inspect the umbilical location, color and contour. So the umbilical skin tones is similar, and or even like it's pinkish. So um, now I'm gonna be um, inspecting for its skin temperature. Don't move, sir. Okay. So after that, look across the abdomen at a level slightly higher than the patient's abdomen. So um, so next is you need to stand at the foot of the patient and observe for abdominal symmetry. So this one. So the abdomen is normally flat rounded or scaphoid, in which is seen um, by this patient. So it should be evenly rounded and symmetrical. So while doing the inspection, also I observed for abdominal respiratory movements, aortic pulsations, and peristalsis measures. So um, peristalsis measure, you'll be using a tape measure, and it's gonna be measuring the patient's abdomen. So I'm gonna be measuring it. Okay. So so um, after measuring the patient's abdomen, so we'll be using a stethoscope to avoid starting the patient of the coldness of the stethoscope. So now, escalate for the abdomen contrast for at least 1 minute. each starting from right lower quadrant in a clockwise pattern, noting for the intensity, pitch, and frequency of the vocal. So now I am expecting for a vowel sounds. Now, to listen for the vascular sound, use the Bell stethoscope and listen for bruise over the abdominal aorta, um, and also for the femoral arteries. And now listen for um, the friction rub over the liver and um, friction rub of the liver and spleen. Now proceeding for the patient's abdomen. Um, uh, we have four quadrants to determine the presence of sympathy or dullness. So sympathy is a high pitch that indicates a hollow space filled air by dullness and suggests fluid or um, what you call this um, feces. So now focus for the vertical liver span and the mid-clavicular line. So from the right lower quadrant along the mid-clavicular line, focus upwards towards the liver and note the change from sympathy to dumbness and mark this. So right lower quadrant first. So um, when you observe, you need to mark at this point. Now, for cross and right clavicle line, an area of the lung, the third intercostal space, and percuss downwards to the liver, and the note the change from lung resonance to liver dullness, and mark this. So as you observe here, need to mark here. Okay. So now for the vertical liver span at the um, mid-sternum line, starting just above, upward toward the liver, and note the change from thin potato dullness and mark. So we check in here and then mark um, to the area. Now for the upper border, start progression of the body of the sternum along the third intercostal space and perhaps downwards until the tone changes from flat to liver. So let's do it. So mark again the area. So now you need to measure the distance between the 2 points. So the nerval liver span at the mid-clavicular line is about 6 to 12 centimeters, and the normal liver span along the mid-sternal line is 4 to 8 centimeters. To assess for liver descent, ask the patient to take a deep breath and hold it while pressing from the right lower quadrant towards the um, uh, and also note for the change of the timony and dullness. So, okay, sir, I need to take you a deep breath and hold for it. So, please hold it. Okay, you can now exhale and then mark here. I will mark it later. So now, you can exhale down now, sir. So measure the distance between the lower border and the right coastal margin along the So that's the so now let's reposition the patient by a lying position with left knee flexed and identify the lower exterior uh, line. So to assess the ano, so now reposition the patient by lying position with left knee flexed. So let's identify and assess the sides of the spleen percus, the left anterior. So let's identify the dullness at the sixth rib. Take as the patient take a deep breath and percuss. So you can now take a deep breath, sir. Okay. Okay, so um, perform the liver band percussion to assess for liver tenderness. Place the left hand flat against the lower anterior rib cage. So um, after you reposition the patient's hand, then use the ulnar surface of the left hand to strike at the right hand. So, okay, sir, feel any pain? Do you feel any pain, sir? To perform the kidney punch to assess for the kidney tenderness, reposition the patient in a sitting position. So, and then place left hand at the coastal rib angle at 12. Okay, so now this is the back view of the patient. Use the ulnar side of the right to strike against the left hand and ask for anything. Do you feel anything? Okay. Do you feel any pain? So now, test for a scientist test for shifting dullness while the patient is lying supine on the bed. Percuss the flanks of the patient from bed towards the umbiculus, noting from change dullness to tympathy and mark this power. So um, next, okay, now reposition the patient to sideline position and perhaps the abdomen from the bed upward and nothing for the change from dullness to tympany here. So roll on your side. Okay. So far the for wave test, you press the edges of his hand firmly down the middle of his abdomen, sir. And to keep your hand here, sir. Press it down, please. Thank you. And then tap one flank sharply with the fingertips to feel for fluid wave transmitter. Okay. Um, Perform light palpation to assess for tenderness and presence of mass in the client lying relaxed in the supine position. So begin with a light systematic palpation of abdominal regions using the figures pad initially in any area of the patient. And observe for reports of pain tenderness regarding for its behavior. So perform the palpation, which is done to feel for the internal organs and muscles. So feel for the internal organs. Compress the abdomen to a maximum 5 to 6 centimeters. So the painful areas and palpated for muscle faces us muscles. So now perform a moderate palpation. Um, perform a moderate palpation at the umbilical ring, looking for a presence of muscles and swelling to assess for tenderness and presence of mass. So um, for the palpation of the abdominal aorta, use both hands to deeply palpate the pedestrian slightly in the midline. So now palpate for the liver to assess for liver contour, the presence of tenderness and irregularity. Now place the left hand under the back at the level of 11 and 12 weeks. Now margin the fingertips pointing towards the client's head. So instruct the client to take a deep breath, then compress the fingertips upward and inward the whole border of the liver and assess for contour surface, presence of tenderness and irregularity. So please take a deep breath. Okay. Again. Okay. Now, okay na to. Okay, now perform for the hooking technique. Stand at the client's right side um, facing his feet. So, so um, I will be performing. So press in, and okay. So take a deep breath, sir. And firmly pull inward and upward with the fingers. Okay, for the liver edge as it distance to meet the fingers. Okay. So feel the presence for irregularity and tenderness. So, take a deep breath, sir. Okay, again, sir, please. Okay. So, forecast the spleen and assess for the um, splenomegaly stand at the patient's right side and reach over the patient's abdomen. So, with the left hand under the posterior lower ribs and pull gently at the right hand below the left coastal line. Press into toward the spleen and ask the patient to take a deep breath. Press inward and upward using the right hand as the left hand is as the support. Crystal, we try to feel the tip. Okay. Assess for tenderness. Sorry. Okay, sorry sir, can you take a deep breath please? Again please. Okay. Now repeat the procedure with the client lying on the right side with legs somewhat flexed and the hip and needed. So, sir, I need you to turn your body at your right side. So now, take a deep breath. Okay, take a deep breath. Okay, now, palpate for kidney enlargement. So, place the left hand under the patient's posterior flank and the right hand at the coastal margin knee muscle. So, take a deep breath. So, ask the patient to inhale, exhale. Apply pressure to the right hand at the right kidney. Okay, please take a deep breath, sir. And inhale, exhale. Hold. Okay, breathe now. Again, take a deep breath. Inhale. Hold. Okay. Okay, sir. Okay, sir. Thank you. So, return the left kidney with the procedure. Okay. Now for the referred rebound tenderness or rubs inside faintly deeply in the left lower quadrant. So quickly release pressure. Okay, do you feel any pain, sir?
Yes.
I was pressing your abdomen.
Yes.
Do you feel pain when I release pressing your abdomen?
Yes.
Now for the next um, assessment, it is the appendicitis test. So reposition the patient at the right side. Right position. Okay. Now, reposition the client facing at the right side, and then um, extend his leg. Okay, sir, do you feel any pain? Okay. So, um, now, for the next procedure, it will be doing a test for operator sign. So now support the uh, client's knee and ankle. So after doing the assessment, um, let's proceed for the um, hypersensitivity test using a sharp object stroke. So the patient's abdomen. So do this several times. Sir, are you feeling any pain in your abdomen? Okay. So on exaggerated sensation felt on the right lower quadrant is a positive skin hypersensitivity. So it may indicate appendicitis. So for the test of pleurisitis, press the fingertips under the liver border. Ask the patient to inhale deeply and note. Um, Sir, can you please inhale deeply? Do you feel any pain? Okay. Okay, thank you, sir. So, a positive Murphy sign is when the pain occurs when the examiner's hand comes in contact with the gallbladder. So, so that is it all for today, and I hope that you learned something about the abdomen, the assessing for the abdomen. So, um, I am Fernand Isaladar, your student